Welcome back to the channel, dear friends, and in today's video I'm going to demonstrate the technique that I use for removing continuous corneal sutures. So penetrating keratoplasty was done for this patient about 14 months ago, and this patient has now developed a dense nuclear sclerosis and needs to undergo a cataract surgery. Planning cataract surgeries in post-PK patients is a little different. We need to first determine the final keratometric values that we're going to use for doing the biometry. So in this particular case, we're going to remove the corneal sutures before we finally decide what keratometry is going to be used in the biometry. So I'm using a bent 31 gauge needle, and I'm using the tip to cut the suture loop at the host portion of this graft host junction. You will notice that all the cuts that I make will be on the host side. This is going to be as atraumatic for the graft as possible, and all the suture removal will be done from the host side. One has to dig beneath the epithelium to reach the suture loop, because after 14 months of a keratoplasty, the sutures have been well buried under the epithelial layer. So here we are attempting the second cut on the host end, and we have finally managed to loosen out a loop from the host side. Going in a clockwise manner, we are now attempting to remove the suture loop again from around 9 o'clock position, and as you can see, it comes out very easily. The suture loop is now cut with this Warner scissors because I want to pull out a short segment of the suture and not pull out a very long segment of the suture altogether, because it has been known that when we are doing continuous suture removal, and if you try and attempt to pull out a very long segment of a continuous suture, graft host dehiscence has been known to occur. We're now proceeding in a counterclockwise manner from the 6 o'clock position and pulling out suture loops again from the host side of the graft host junction in the similar manner. Doing this procedure under topical anesthesia can be challenging sometimes, as you can see that the eyeball is moving quite a lot, and in case you are holding a 31 gauge needle very close to the corneal surface and the patient moves the eye, you might cause inadvertent trauma, and that's the reason I'm using a sterile cotton bud to stabilize the eye so that the eye doesn't move too much when I'm doing the cutting part of the suture removal. At this point, I'd like to reiterate on the fact that all the manipulations and all the cutting portion of this procedure is being done from the host side of the graft host junction. We are being as atraumatic for the corneal graft as possible. So after removing the final suture loop, I patched this patient's eye overnight, as a patched eye is more comfortable for the patient and he doesn't have too many symptoms. And on the first post-operative day, you can see that the cornea is very clear and the patient was very comfortable. And of course, because of the cataract, his vision was about counting fingers, 3 meters. And I hope that I was successful in demonstrating an atraumatic technique for continuous corneal suture removal. Thanks for watching this video, and we'll see you in the next one.